Good morning, everyone. My name is Darren Dumay, and thank you, Dr. Graves, for your great speech. I just want to say thank you for all the hospitality from all the doctors, the generosity that I received to try to help you. You also helping me. Thank you, and I look forward to coming back and trying to make more progress with your progress in the hospital itself. And thank you.
It's been a really good week here at the Carl Huschner. There are really many rewards from personally, professionally, realized from coming here. It's a great feeling to bring these ventilators and equipment to Belize and to spend the time teaching the very enthusiastic healthcare professionals here. The challenge going forward from today for the nurses, docs, and respiratory therapists who are able to spend time with us and begin to master this new technology will be to continue to work closely with these ventilators and all the apparatus that comes along with it. We feel that the Carl Huschner can best support this effort by creating a dedicated core group of resource nurses who do not rotate out of their area of expertise, and therefore they can become educators themselves. And the teacher becomes a student, the teacher becomes a student. We think that that would really be a wonderful way to build on the beginnings of what has started this week. Thank you very much. It's been a wonderful week.
Good morning. My name is Katie. I'll tell you a little story. About 10 years ago, the local newspapers wrote an article about our first trip to Belize, and they titled it, "Breathing Hope into Belize." Hope is a good thing, especially when it results in excellent success. The doctors, the maintenance people, the engineers, security, the entire healthcare team here at the Carl Huschner have persevered, worked very long hours, long shifts, and they've learned and they're practicing safe, effective, and very good medicine here. Now, and near and dear to my heart, they have respiratory therapists. And I'm very proud of the 2 respiratory therapists that are here working at the Carl Huschner. 10 years ago, while working at the Carl Huschner, we hoped the oxygen would work. We hoped the electrical outlet that we were going to plug the ventilators in was safe. We hoped that there'd be enough medicine and the right kind of medicine. We hoped our time was well served. Well, this past week is very evident that the healthcare team providers here at the Carl Huschner have moved beyond breathing hope. Baby needs a life-saving breath machine here at this hospital, they get it. The team jumps right on it. They do the right thing. They're right there. The tubes go in and the baby survives. They save lives here at the Carl Huschner. How do they do this? I think they do it because they have champions. Champions that do the long hours and have strategy over the years to keep going. And that's, I'm talking about Dr. Hidalgo and Egbert Greenwich. They are the real champions here. They are the hard workers. They're the ones that have persevered. I am very proud to be part of the success at the Carl Huschner, but I am only a small part of a much larger medical missionary group. Our group is called Medical Care for Children of All Races Everywhere, and we visit Nigeria, Belize. Belize is my home. And we are now going to go next month to Haiti. And our mission is not to drop off equipment, not to just take pictures, and never to return. We come here to teach you how to fish in your backyard. We teach you how to provide good medicine long after we are gone. Well, I can say that our mission is very well served here. Better breathing is at all levels at the Carl Fusner. You guys have done a really, really fine job, and we do plan on returning. Thank you.
Thank you, Katie, Lenore, and Darren. We'll now call on Dr. Francis Lonsworth, our CEO, to come and give the vote of thanks.
Good morning, all. It's left for me to say the last few words at this occasion. And I'd like to say to the medical care group and Katie that it's been a remarkable journey over the last 10 years. And it was born out of a simple need, which was to have children ventilated. And it needed someone who was determined to make it happen. And happily everything came together, and this mission has been coming to Belize over the last 10 years. And hundreds of lives have been saved by judicious use of mechanical ventilation. We started out with the most basic of techniques. Dr. Greenidge mentioned bagging of patients. That's what Katie found when she came. And she introduced mechanical ventilation. And now we're getting into advanced machines. The name gives it away. VIP Gold. You know, we're going from gold, I suppose it's platinum after that. And what was unknown at the time, 10 years ago, our staff knew nothing of these techniques, is now the norm, commonplace, every day. And that's a remarkable achievement. And it sets the stage for what we plan to do over the next several years. It has had impact also on how we manage our adult patients in intensive care. We're hoping that specifically with regard to pediatrics, that we'll be able to renovate and expand the existing ICU, neonatal intensive care unit, and that we'll be able to, in the next several months, design and build a separate pediatric ICU in the hospital. This is very necessary because of the caseloads that we're getting now. Someone asked earlier, I think we have as many as 14 ventilators throughout the hospital now. And I think Jules asked, why so many? Because they're needed. And believe you me, we were begging Katie to get here quickly so that we could get the other 3 or the other 4 that they brought. Because we had people waiting in line, children and adults, waiting in line for ventilation. And that's the reality of the KHMH today. So I'd like to say thank you for your commitment and the very important contributions you've made to the KHMH and the care of children and babies over the last 10 years. And I hope that we'll have you with us for the next stage of development of care and the journey that the KHMH is on to become a center of excellence. That's Dr. Bulwer likes to call it a center of excellence in tertiary care for the country of Belize and the region. So thank you very much.